Let us discuss about an important topic regarding hypertensive retinopathy. Hypertensive retinopathy is a feature that occurs due to increased BP. That increased hypertension will lead to the damage in the end organ damage. One of such end organ damage is our retina. So what happens is any primary hypertension or any secondary hypertension will cause ophthalmic artery hypertension. This ophthalmic artery hypertension will cause different various stages, like in stage 1 mild or vasoconstrictive stage, where there will be an acute and chronic vasospasm, and that leads to diffuse and focal arterial narrowing and vascular toxicity. There will be diffuse and focal arterial narrowing and vascular toxicity in the first stage of vasoconstrictive stage. In stage 2, there will be a sclerotic phase where there will be atherosclerotic and hyalinization stages over the vessel wall, and there will be thickening of the arterial wall and venule crossing that arteriole, that is AV nicking. And in the stage 3, there will be severe or exudative stage where there will be blood retina barrier will be break down, and that causes dot and blot hemorrhage in the inner retina and flame hemorrhages in the nerve fiber layer that cause retinal hemorrhage. And there will be yellow hard exudate, and there will be cotton wool spot. Cotton wool spot are the fluffy white ischemic lesions near the nerve fiber layer. And the fourth last stage will be your malignant stage. That malignant stage will provide us astig spot. What are astig spot? Astig spot are hyperpigmented patches surrounded by hypopigmented ring due to retinal pigment epithelium clumping around the atropic areas in the choroid. So these sclerotic phase to malignant phase will cause retinal detachment, vitreous hemorrhage, and CRVO or CRAO. This is regarding Keith-Wegener classification. Your Keith-Wegener classification has 4 gradings. Grade 1 is arterial attenuation. The artery and the vein ratio will be 1:3. Normally, the artery and venous ratio should be 2:3. But in here, the arteries will be constricted. So during the vasospasm stage, vasoconstriction stage, the arteries will be narrow. So it will be in a ratio of 1:3. And the second stage, that will be your Salus sign. Your Salus sign is nothing but deflection of the blood vessels. And in the grade 3, you will have Bonnet sign, Gun sign. Bonnet sign is the banking of blood vessel, and Gun sign is tapering of the blood vessel. And you will be having flame-shaped hemorrhage with cotton wool spot and copper wiring of the arterioles. In grade 4, you will have silver wiring of the arterioles and papilledema. So this is your fundus picture that is showing various phases. In vasoconstriction phase, there will be generalized narrowing. In sclerotic phase, you having focal and generalized narrowing of vessels and AV nicking, and wall opacification is seen in the sclerotic phase. And in exudative phase, you could see hard exudate, cotton wool spot, flame-shaped hemorrhage, and dot and blot hemorrhage. In your hypertensive choroidopathy, you could see Seigrid streaks. What is Seigrid streaks? Seigrid streaks are the linear opacities along the choroidal vessels. And your astig spot, as I said, the astig spot are the blackish spot surrounded by yellowish surrounding area. And fourth stage is hypertensive optic neuropathy. That is your optic disc swelling. This is your chronic hypertensive retinopathy, where it shows 3 signs: Salus sign, Bonnet sign, and Gun sign. Salus sign is nothing but the deflection of the blood vessel, and your Bonnet sign is nothing but the banking of the vein over the AV crossing, and your Gun sign is nothing but your tapering of the blood vessel. So thank you. One change I should mark. This is the modified SCIC classification. This is the modified SCIC classification, where first one shows grade 1. Grade 0 is no changes in the fundus picture. Grade 0 is no changes in the fundus picture. Grade 1 is barely detectable arterial narrowing with toxicity of retinal artery and silver wiring. Grade 2 is grade 1 plus AV nicking, and grade 3 is your grade 2 plus flame shaped hemorrhage with cotton wool exudate, and grade 4 is your grade 3 plus papilledema. Thank you.